From my perspective as a program manager in Ghana, I see what NCD means to the common man. We do have relatively good governance structures for NCDs with the support of our partners, and this has been happening since 2018. We do have an NCD multi-sectoral steering committee. We have technical working groups that work in the NCD space. We do have policies, guidelines, you name it, we have them. At the other end of the spectrum are the patients who are still having to bear most of the cost out of pocket, and we see the resultant catastrophic health expenditure that they need to endure. So the policies don't directly reflect in how well the patients are enduring or responding to the NCD prevention and control activities, which makes it crucial for us when financing is being discussed. Previously, we would talk about integration and hoping that the health system would automatically take up the NCD prevention and control concept, but that will not happen. We need to be deliberate. We need to be intentional. And that is how come it's relevant for us that financing is now put in the spotlight for NCDs. We do need to invest more in our data systems in order to be able to better tell our stories. We do need to be able to count and mark where we are going. How is our progress being measured? Of course, you need the data to tell those stories. How well are our patients being controlled? You need the data to tell those stories. So we need to invest a lot more in our data systems. But then for a sense of direction, I believe Africa has a good direction currently, and we are making progress, but we need to escalate our efforts towards 2030. We need to ensure that the non-health actors are brought into the mainstream. But for us, out-of-pocket expenditure is so huge that patients would end up looking for alternatives or other options, and we need to ensure that we reduce the out-of-pocket expenditure to ultimately keep our patients in care and better control their NCDs. The health system is naturally structured to be extremely responsive towards communicable and infectious disease, maternal and child health, but not so much for NCDs. And this is why the narrative needs to change. If we are deliberately targeting NCDs, obviously we need to finance NCD prevention and control activity, especially at the primary health care. So we need to be more deliberate in our efforts. So it's both in acquiring new finances as well as working with the existing financial mechanisms to ensure that we are more efficient in addressing the challenges of the patient ultimately.